Ready?
Ready? Great. Okay, ladies and gentlemen, I'd like to call the Tuesday, October 29th, 2024 meeting of the Regional Council to order. The first item is a roll call attendance.
When I call your name, please say present. Jason Zimmerman or Joshua Hartman. Chief Grace Cacciola.
Present.
Bradley Kaufman.
Present.
Andrew Dahl or Allison Burke. William Goffin or Dominic Bettinelli.
Present.
Daniel Mizels. Robert Bristol or Max Goldfarb. Travis Kessel or James Downey.
James Downey, present.
Gerald Gilbert or David McTansky.
Gerald Galvin, present.
Joseph Schenker.
Present.
Michael Rayola.
Present.
Michael Vatch or Mordecai Lax.
Here.
Martina Baccarella is absent. Marie Diglio.
Present.
Nancy Benedetto.
Present.
Arthur Cooper. Robert Krupe.
Present.
Megan Kessel. Manfred Fuchs. Benjamin Fay.
Present.
Benjamin Fay is not here.
Present.
Michael Coombs.
Present.
Eugenia Langston.
Present.
Brian Levinsky.
Present.
Dennis Laurie. Warren Barzilay. We have a quorum.
Thank you very much. Next item on the agenda is the approval of the September 24th, 2024 meeting. The minutes have been distributed. Are there any comments, corrections? Motion to approve would be in order. Second. Thank you. All in favor, say aye. Any opposition? Any abstentions? The minutes are approved. The next item is the correspondence report. Okay. An appointment letter was received from the New York State Volunteer Ambulance and Rescue Association informing the office that James Pointer will replace Travis Kessel as the representative of District 4, with James Downey appointed as the alternate. Is there any discussion? We need to take a vote on this. Hearing none, I don't think we need a roll call vote. Anyone opposed? Any abstentions? Please mark it as unanimous. Thank you. Next, we received nothing from FIDNY EMS. The Office of Regional EMS Council received a letter stating that the Regional EMS Council of New York City, sponsor 08014, is a valid sponsor with the Bureau of Emergency Medical Services and is approved to teach certified lab instructor updates. The agreement is in effect until June 30th, 2026, when the office must apply for renewal. So we're back in business. Okay. We've heard during the ambulance committee report regarding the response we received from Donald Trespass, I don't know how to pronounce his name, from DOH Business regarding Throgs Neck and Ridgewood, and that they are still adjudicating this, the failure to operate for more than 30 days. So of course they'll be on this for more than 30 days. And offer other outstanding items. Once the department feels it's appropriate, they will act on this item. New York State DOH. Unfortunately, we heard that there's really no due date for this to be done, so it will be in limbo for another while until we write another angry letter. Okay. Here's the enforcement actions. Davin Eshelman of Lyman, New York. I have no idea where that is. Number 391815 is suspended for 1 year effective September 2024 for violating various parts of 800, and it is stayed pending 3 years of successful probation without further violation and assessing of a civil penalty of $8,000. Okay.
Wow.
6,000 is stayed pending successful probation. Okay. Tyler and Fendick, Lockport, New York. Number 402731 is suspended for 1 year effective 9/10/24 for violating a whole bunch of things. The suspension is stayed pending 3 years of successful probation, successful civil penalty of $2,000. $1,000 is stayed pending successful probation. And anyone can look up the entire list of people who are suspended, can be seen online on the web, which will be included in your minutes. Okay, nothing from New York City DOH. Actually, we did get some from New York City DOH, so that's really not accurate. M1's agencies, none. Course sponsors, none. CME training, nothing new. And we already reported about Gotham ambulance reporting a new ambulance on October 5th, 2024. Now, of all the correspondence reports that I've been reading for the last, how many years? I don't know. The one I'm going to read to you now is the one that's most meaningful. We received a letter from Public School 5, the Huguenot School, on 348 something Street in Staten Island, dated as follows: September 24th, 2024. Dear first responders, on behalf of the students, staff, and families of PS5, we would like to extend our deepest gratitude to each of you for your extraordinary service and dedication to our community and our nation. As we reflect on the events of September 11, 2001, we are reminded of the countless acts of courage and heroism demonstrated by first responders like you. To honor your bravery, our students participated in a special project to commemorate the anniversary of September 11th. Each class took time to learn about the role of first responders and created heartfelt letters, drawings, and messages of thanks. Through these activities, our students gained a greater understanding of the sacrifice you make each day to keep us safe and the significant role you play in times of crisis. Thank you for your unwavering courage, your willingness to act in the face of danger, and your ongoing dedication to protecting others. You are truly heroes, and we are forever grateful for all that you do. With sincere appreciation, the PS5 community.
Wow. Yeah. Very nice. We just passed around some of the cards that the kids drew for us. Really
I
nice.
would ask that the council send back a letter of appreciation for their work, and perhaps even copy this and send it around to all the agencies in the city.
That's a lovely idea. So.
We sent out, that is us, the regional council, agendas, minutes, and associated attachments for the meeting. Okay, the 2024-04 EMS supply chain distribution IV shortages advisory was sent out. The office of the regional council released a statement informing the region of the appointment of Joseph Renari as acting executive director in lieu of Scott Chiang being placed on leave. Congratulations, I think. And I, which really doesn't mean that I did it, but they did, okay, sent a letter to DOH complaining about their not moving about Throg's Neck and so on.
Yeah.
And that was the response that you got, so don't hold your breath. Okay,
Yeah. I saw it.
what is this? This wasn't on my list. Yes, this we voted on already. Okay, we are now up to the next item on the agenda, is with staff reports. Anyone have any questions on any of the correspondence? No, let's move on. Staff report, emergency preparedness update.
Thank you. So the offices of the regional council is in the process of renewing its status as an opioid overdose prevention program with the New York City Department of Health. So as a reminder to all the services, New York City REMSCO, we are able to distribute naloxone to your ambulance services. So if that is something that you need for your agency, do not hesitate to reach out to our offices to order them. We would also like to encourage any agency that's not currently participating in the Narcan Leave Behind program to reach out to us and do so. We have the kits available, and that should be something that that your agency participates. It's certainly a citywide effort. We've also been working with New York State Assembly Member Daniel Donald's office to get a grant to replace and update the REMSCO mutual aid radios, if anybody remembers them. Those radios have been inoperable since EMS went to encryption. So we are working to update and replace those radios so that we can get them back in service again. So we'll have more updates on that as that project moves forward. We did receive one request for mutual aid since the June 2024 meeting, and that was to request volunteer unit participation for the New York City Marathon on November 3rd, and a rave notification message went out from our system to the volunteer ambulance services. We're putting out that request for the fire department. And that concludes our report.
Any questions? Hearing none, let's move to program agency update. That's you again.
So the fiscal year 25 program agency contract has still not yet been released, despite us now being 4 months into the first quarter and of the deliverables for that contract. All of the regional program agencies throughout the state sent a joint letter to the State Commissioner of Health, urging the commissioner to prioritize the release of those contracts and requesting an update from the commissioner's office as to why those contracts have been delayed. In the meantime, staff is preparing all of the materials that are necessary for us to be ready to submit for our first quarter voucher once we do receive the contract.
Thank you. Any questions? Moving on, ambulance committee. Marie, let's see you.
Oh, yeah. Hello, the ambulance committee met immediately before the regional council. At this time, we have no applications for transfer of operating authority, and we have no applications for determination of public need. As you've heard before, we have been discussing the status of the transfer of operating authority of Throgs Neck Volunteer to Ridgewood Volunteer Ambulance Corps. We're not really sure why the state has sent this forward to legal, since agencies not operating in excess of 30 days, that has never been a barrier to doing a transfer. And we believe it's a disservice at this point to the communities that these volunteer agencies serve, because they can't function, and there's really no reason for it. We don't see any legal barrier to it. I think our next step, or not our next step, may be for the agencies themselves to reach out to their elected officials to make some noise up in Albany and not see these items just buried in DOH legal, because there's no timestamp there. The rest of the laws have 60-day, 30 days requirements. Once it goes into legal, it can stay there until the end of time. So I think that we'll be reaching out to the agencies involved and letting them know they need to personally reach out to their elected officials. Our tags also have been doing work. Okay. The recruitment and retention tag, which is Mr. Coombs. Am I pronouncing it Combs or Coombs?
Combs.
Coombs.
Combs. Like hair combs.
Combs, okay. Combs. We're going to have a presentation a little later in the meeting. They did a great job reaching out to health insurance agencies, and we'll present to you in a few minutes, to help our providers who do not have full-time jobs. You know, many of our providers, they work part-time at many different places, and that doesn't make them eligible for insurance from their specific company. So we're going to be able to give them options to get insurance on their own. which is a big deal. We're really happy we're able to do this. And also the volunteer assistance tag, which is Jerry Gelbart. They are working with agencies to prepare themselves for state inspections. Even those inspections have been put on a pause. Okay. Everybody's overwhelmed. There's not enough EMS providers anywhere in this country, and New York is not, is also dealing with that. So thank you to Jerry and the New York State Volunteer Ambulance Association for that. Another tag that is being revitalized is the REMSCO ID card. We are going to be forming a tag to discuss the ID cards, to identify what their role is at this point in our history. As Joe reminded us, when they first were issued after 9/11, many of our volunteer agencies did not have their own photo ID cards. Many agencies did not have that, so we were providing a service. At this point, I think everybody has photo ID cards. So we need to identify what is the reason that we need a regional ID card. Is this still necessary? And if so, what? And also to consider the financial implications of getting those cards. And also our security sticker tag. You said, Joseph, that we're waiting for a vendor, or, I'm sorry.
We're just trying to identify an appropriate platform that's going to manage the backend database for it.
Okay. And that's all that I have from the ambulance committee. Anyone have any?
Questions from the room? Thank you very much. Next item on the agenda is the Training and Education Committee. Maureen?
Training and Ed did not meet, but is going to meet again this Friday. I'll just report real quick on completion rates for the protocol update, which are not great. On the BLS side, 50% of those that were assigned completed it, and on the ALS side, about 70%. So one of the things we're going to look at the end of this week is some possible reasons why that is. One of the things we did differently this time around is we assigned it directly through the LMS directly to providers, which we thought would be a better way to do it than just having the agencies. So rather than the agency alone being responsible for it, we kind of tackled it from both angles. And for some reason, the numbers are still low. So we're gonna look to see if the list is still accurate. These are all still active providers, especially the medics. And if the list itself needs to be updated, I'm not sure if there's a way to do that, but we'll look at it. The other thing that we did is there was a survey that went out along with the protocol update. About 3,000 people responded to that survey. Overwhelmingly, the answers were either neutral or positive. I saw very few, if any, negative responses to any of the survey questions. They're mostly about how the platform behaved, if it was put together well, if it served its purpose, according to people's beliefs. There was one question that was asked about whether people thought something should be changed in protocols. And interestingly, there was very little response to that question. And the rest were QA related questions. So we're going to take a deep dive on some of those QA questions and feed that information back to REMAC and protocol. That is all.
Are there any questions? Thank you. Thank you, your committee.
Yeah, so
You're
on,
next.
well, no, I want a question about that.
Oh,
As far as the compliance with the upgrade and the update and our going forward in a region with people who are not compliant and not compliant with the updated protocols, I think we have to put the onus to some degree on the agencies. As a region, we credential the agencies, and the agencies, when they submit their credentialing, have to verify that all of their providers are up to date with what they're doing. I think we need to make a list available to each agency. Do people define their primary affiliation?
Yeah.
So to their primary affiliation, to say to them, if you're going to attest that these people are current, they need to be current. Because the reality is we switched to the LMS because we thought it would be better and easier and more convenient for people. But if we're not going to get compliance, then now we have providers who are not operating under the appropriate protocols. And I think that's more dangerous to the system. So I think it's important that we send out a list to each of the agencies that their primary providers, so-and-so and so-and-so are not compliant or are compliant, so that they can address it, because ultimately the responsibility falls on them.
I'll work with Joe on, getting that list together and getting that to the agencies. The agencies also all have their own access to report on any of their people, whether it's primary or secondary affiliation, so they can see who's still outstanding.
Are you talking about ALS or BLS?
Well, the region is really only credentialing the ALS
Exactly,
agencies,
that's what I was
which is
thinking.
true, but at the same time, there has to be some mechanism in place to ensure that your providers are maintaining their certification.
You are
If we're
right.
going to switch to a CME, for lack of a better word, based refresher program, then there has to be accountability for that. Otherwise, we're just not maintaining anything.
You are right, except that the state thinks that only they have a right to do credential, and it's the EMT card that counts and not us. And while I disagree with the state, they've made that very clear, and there are several lawsuits going on about agencies don't let providers work within New York State.
True, but agencies have a right to not, I don't know what the word is, not credential, it is, no, it's, what's it called? There's credentialing and then there is
Competency.
competencies. They have the right to ensure competencies. And it's the responsibility of the medical director. In our region, we have the advantage that all the medical directors have agreed to participate in medical standards and in REMAC, and therefore the REMAC operates as a single unit. But the ultimate responsibility falls on the medical directors and on the agencies to ensure that their providers are meeting their competencies, if that's what you want
The
to call it.
state's gonna argue.
I understand, but the
They
medical
issue a
directors
card
still have the right.
Signed by Ryan Mibber, that means the person is competent. And what
No,
you're
that means the
saying
person is
is,
credentialed.
that you think it's
That
not
is,
true.
that doesn't mean the person is competent to operate for agency Y or agency X.
I
It
don't
means the
disagree
person is
with you in
credentialed
principle,
to operate.
But knowing what's going
But
on.
that, and even Ryan has agreed that the medical director has the right to restrict a provider in his or her agency.
I just wanted to repeat again for the record, the Department of Health has been asked to tell us in writing that we cannot credential. And they have not written us that letter. So as long as they're not telling us that we can't credential, we are credentialing. And also from what I understand, I don't know if this is true, I have to do a little more research, but the original case, this lawsuit, from a paramedic against an agency, the agency won, so we'll get a little more information on that. And like I said, the state has not been able to say in writing that we cannot credential. And that's still an argument up in Albany.
Is there a consequence for an agency that allows a provider or a paramedic to operate when they're not updated on the protocols? And if not, I think there should be, not that we want to be necessarily punitive, but certainly a warning or a number of warnings if they're allowing that to happen.
A paramedic, yes, who has to work under a system, there's no question about that. But an EMT can work anywhere in New York State, whether they're associated with an agency or not. Okay,
So let's stick with
kid
paramedic.
Get an EMT card in high school and then respond.
I'm just saying, when you find out that there's a paramedic who's operating for an agency, and you look at the list and they have not been updated,
That would
they should
certainly
receive
be-
a letter with a warning and appropriate information
Yes,
the first time and maybe the second time.
yes, 100%.
And then there should be some other consequence.
Any other comments, questions?
In
Yes,
New York,
yes. Oh, go ahead.
in New York City, your agency is approved to operate at the ALS level by the REMAC, and the REMAC requires that your paramedics are credentialed by the city. So, and what we have done in the past, if we found out, we haven't had to deal with the paramedic issue. We've had physicians that they've lost their medical director or whatever, and we've had to send out cease and desist letters.
Mordecai, do you have any capability of determining
but people did not open that email and send them a second notice?
So yes, in fact, Joe sent, I think, 3 or 4 notices with reminders as the date, as the deadline approached.
All right, so we can't even tell whether these people that haven't updated are even active in the system.
We
Providing
can
care.
see if somebody's active in the system, for sure. We can check, we know when we can run reports on when the last time somebody was in was. That information is available, but I mean, ultimately, agencies really can be watching them, but they have the same level of administrative access as we do to their own people.
Yeah, to be fair to both the agencies and the providers, one thing to understand is the total list of providers that are in the system. Right, a lot of those profiles were pulled in from the State Vital Signs Academy. So providers you may have some of those, maybe providers with multiple accounts. So you might have one ENT that's got 3 accounts in there. On their primary one, they did the update, and the other 2, it just shows, right, the system doesn't know that's all one person.
Right.
Yeah. So that's something that we do plan on resolving towards the end of this year. We're getting ready to put in some kind of annual policies that will require providers to kind of update their profile every year. And that should refresh the list to try to keep it somewhat accurate to the number of active providers in the system. So there is a bit of that going on. But one of the things we do have the ability to do is run reports and send it to the agency leadership and say, hey, these are the providers on the LMS that are indicated they're affiliated with you that haven't done the protocol update. Go follow up with them.
Yeah, just to tack on to that, Joe's right. And when I indicated before that we needed to do some cleanup on the list, that's really what needs to be cleaned up. There's some duplicates and there's some people that may not even be anymore. So,
Agencies do have access, you said, right?
Yeah.
To look at the.
yep, and the training coordinator for each agency.
It's a training coordinator. I wanted to see who.
Yeah,
who
the
had
training
that.
coordinator, yeah. And if there's anybody else in an agency that an agency wants to give access to, we can.
No, but I agree
do
that
as well.
the only way to do this would be with the agency to be able to look at the individuals. I mean, how many thousands of providers you have versus maybe
Yeah, so,
hundreds of eight.
Yeah, we're gonna have to
agencies.
sync it with the state as well. It's
But
gonna
we
be
can clean up our own list.
Yeah.
Enough people have, every agency, if you don't comply with our regulations, you have to go. You leave the
Right.
agency, whether it's corporate compliance, HR rules, updates.
correct. So the other part of that is while we might remove somebody from an agency list, they're still on the overall list.
Yeah.
So when you look at compliance, their name is still there. So we have to
Absolutely.
address that. So.
Okay, thank you very much. Again, thanks for all the work that's been done. Next is Quality Improvement Committee report. Who's giving that? We have a chair of that committee.
She's
Not on this committee.
I know.
I have no problem giving the report, but I wasn't there.
If you give me one moment, I'll just pull up the minutes.
They're Joe, he's got it.
You have a copy of the folder, Michelle?
I don't have a copy of it.
Joe's getting it, he has it on his computer.
I have the minutes. I'm
Go ahead.
pulling it up. Yeah.
Oh, it's right here.
Right, the Quality Improvement Committee of the REMSCO and REMAC met virtually on October 9th. The following is a summary. The QA committee is seeking to fill 2 vacant seats, 1 physician seat and 1 paramedic seat. So the chairs are going to meet to identify appropriate candidates for that. And obviously, if there's anybody on this body that would like to fill either of those seats, please talk to Dr. Langsam and Dr. Shanker. We did not have any regional restrictions to review. A letter is going to be going out to EMS agencies, reminding them of the First Watch regional platform, that it's up and running, ensuring that agencies have access. We're also developing a short 30-second video on how to access and navigate the platform. We'll be rolling out regional First Watch platform spotlights, highlighting a couple of quality measures. One will be on obtaining blood glucose for suspected stroke patients. The other will be aspirin administrations for patients with chest pain. We are awaiting the rollout from the New York State Department of Health Bureau of EMS for their biospatial program. Biospatial is a dynamic reporting system that allow us to do more analytical reports on our regional data. My understanding is they're just waiting for the program agency contracts to come out before they can roll out access to that to the regions. The committee revisited previous quality projects on airway management and pain management, and will review previously gathered data to determine their utility and to continue collecting data on these measures moving forward. The BLS IGEL data was submitted by participating agencies, including the Medicine System and Ridgewood Volunteer Ambulance Corps. Ridgewood reported no uses. The quality team is going to ask the Medicine group if they can present at the December QA meeting on their data. And the next committee meeting will be on November 8th.
Any questions? Next item on the agenda. Thank you again. Thank the committee. State EMS Council. Grouping.
Nothing to report. The next meeting is in December.
What we did.
Was there a report at the last meeting?
Yeah, there was a report at the last meeting.
Okay.
Okay, thank you very much. Is there any unfinished business? Not aware of it, so we do have one item of new business. If you'd like to introduce yourself, please, to the group and present.
Certainly. Hi, everyone. My name is Christine Haskins. I'm the Director of Client Management for Healthy Business Group. I'm here today with my colleague.
Hey, everyone. I'm Michael. I work on the customer support team.
He's our customer support lead. We're here with Healthy Business Group. You'll often see in the communications referred to as HBG. We were brought in today by Annette Cohen. She's been with you folks for a number of years and was tasked with how do we solve the problem with bringing benefits to your part-time employees? And that's a problem that we see across a lot of workforces where a lot of the gig economy, part-time economy, doing a number of jobs and they're not eligible for employer-sponsored benefits. Not to mention, it's extremely confusing. They could go to the state marketplace, have no idea how to navigate it. And we won't get into how much it costs for a lot of the young people, making it like almost unaffordable in many cases. So we got resources together. I met with Joe and Marie last week and Georgette. We had a nice big deep dive. I won't do that with you guys tonight. But what we did want to show you, and you have that one hard copy handout, is just we've automated and we built you the REMSCO's benefit virtual storefront. So think of it like Netflix for benefits. It's a subscription-based benefit platform. Your people can get on and off a benefit in 30 days. They're not locked in. So if somebody's on an employer or a spouse's plan, they lose their job, they need to find benefits, they can hop on to this platform and easily navigate our plans. Not only, and I'll kind of walk you through this a little bit, but we tried to make it look like if you go on your Facebook page, the imaging looks similar. So it looks and feels like your own. It doesn't look phony. Your top here, you're under your health protection, family protection, and resources for living are kind of the silos where you can navigate through exactly what you're looking for. You see your shopping cart up here, and that's going to be if you decide you want to purchase something, you throw it in the cart. It's pretty simple and easy to use. And then as we kind of push through and go down to all the different benefits, you have both medical, dental, vision, a number of different benefits that you can kind of, as I say, this is the time to check your rate, right? Everything's more expensive now, whether it's medical, dental, home, auto, it's definitely worth your while just to check your rate. As I move down, yes. Oh, I thought we did that. I apologize.
This way, anyone who wants the video can follow.
I thought one. That, we're good? Okay, sorry about that, guys. So as we move down, as I, kind of just to give reference from before, your 3 silos at the top here, as you scroll down to the benefits, the first plan we have is a plan that we think, and I'm gonna let Michael jump in and do a little detail. For a lot of your, first responders or EMS techs, if they're in that age group, say 27, they got kicked off mom and dad's plan, up to say mid to early 40s. This plan is definitely super competitive with the state exchange for a number of reasons. Michael, I'll let you give some highlights on solo.
Yeah, so this policy itself, the individual can choose between 3 different deductible options. They're really just responsible for their payment per month as well as reaching that deductible. There's no co-payments, there's no co-insurance. You're just paying down your deductible. The coverage itself is extremely extensive. And then in terms of what kind of reduces the cost, it does require an EIN, as well as for the individual to answer a brief health questionnaire. They can schedule a consultation with me or my colleague Allison, and we can walk them through this process, and we can answer any questions they have. So yeah, it's a great product. Definitely recommend it for these individuals, your providers, just to take a look at it.
Yeah, a couple of things too to highlight on solo as well. 3 deductibles. Once your deductible is met, the plan kicks in 100%. So there's 3 deductibles, 2,500, 5, and 10,000. And the 25 and 5,000 are, you can also put that into a health savings account. So for young people, that's a real big savings that they can put that pre-tax money away. The 10,000 is not eligible, but all of those little details, that's where our team, they're not going to get stuck in a chat box. They're not going to be stuck waiting on hold. They're going to talk to real people. They can do it over Zoom. They can do it on a phone call. They can schedule it on our calendar link. So as you have on that hard copy that we handed out, the first QR code, because we know everyone has their phone, they can scan that code. It's going to bring them to this site. And then the bottom QR code links with our support staff, where if they know their schedule, they can't talk to anybody until, 4 o'clock because their shift doesn't let them out till then. We can do our best to accommodate, or they can get on the phone. So they are going to talk to a live person, which we think is like a game changer for a lot of folks as they navigate healthcare. So the solo plan is great. Just think about young, healthy, you don't go to the doctor often, and your preventative care is covered at 100%. So as I move down, we also have a couple of lower cost options. These MEC plans are called minimal essential coverage. We help your folks vet what their needs are. So part of the pre-screening is what does your current healthcare look like? How often do you go to the doctor? You want any medication? We want to check if your doctors are in. That multi-plan network that you're seeing next to all of these plans is the largest network in the country, 1.4 million providers. So it's nationwide. So if one of your folks is here, but they're on vacation in California and they get hurt or sick, they're going to be able to find a doctor. It's a nationwide network. These, again, think of it as whatever you're paying is commensurate with your coverage, right? The more you pay, the more coverage you're going to get. Moving down to, these are multi-plan, which we call common sense. It's a MEC, sits on top of what we call a health share. We explain what all of the ins and outs and what you're responsible for. We do ask people to kind of know what they're going to need to do to stay organized. It's not just, oh, I show up with a card. There's a little more ins and outs. I'll bore you with it. That's for your people and our support staff to work through all of that. And then lastly, see the big jump. These are similar to what you'd see in like a PPO plan, silver and bronze, no deductible. So that number that they're paying per month, they're jumping right in with their coverage. There are some restrictions. We go through what all those intricacies are. So I won't bore you with all of those, but they have choices, and that's the key. If you've got some complicated medical problems, we're not going to under or oversell your people or your providers. If someone is better served on the state exchange, we're going to be honest with them about that. Any questions quickly before I move down to the other benefits?
Are there a pre-selected list of primary care physicians?
Yes. So in multi-plan, it's very simple, and that's where our team can help them. We'll either do the search for them, send us your doctors before the appointment, and we'll check if they're in network for you. So we can either do it preferably before, because that saves a lot of time. Or we can do it during the consult. Okay. Along with medical, we have dental and vision. Everyone's familiar with Delta Dental and VSP. These are very competitive prices. And as I said, you can get on in 30 days. As long as you get on by the 20th of the month, you'll have coverage on the 1st of the following month. Now, if you join on the 29th, you're gonna have to wait till what's today, the 29th? You're gonna have to wait until the 1st of the following month, okay? Very easy to quote, but we can help with that. And then some of the other family protections, we've got life, we've got supplemental through Aflac. This is a big one, I think. People should check their rate on auto, home and renters. They're up 50% in some cases. Just check your rate. Even if you decide, it's not for me, I'm gonna stay. I check mine, at least stayed to 1,000, just saying. Pet insurance, everybody's got pets. Not a bad idea to check it out. And then lastly, we have some resources for living. These are things that are in the wellness space. I won't do a deep dive. You guys have been here for a while. But most importantly, this is how you get in touch with our support team. It's not presenting great here, but nonetheless, you can get on, fill it out, you send it to our support team, and then we'll reach out or tell us when's the best time to talk. Would you rather do a calendar invite? Do you want to pick up the phone and call us? We're 9 to 5 Eastern time and have that conversation then. But the key is all of this is in one place. People can access it through the QR code on their phone, as well as reach our support team. That's all I have.
How does this work for people who are affiliated in the region but live out of state?
So we're nationwide. If someone's out of state, we can support them. And I will say, it did come up. Let's just say somebody leaves. They're paying for this out of their own pocket. They pay via their credit card. It's taken out each month. And because you guys, they're paying it out of their own. If they leave, it goes with them. So it's portable. And I think, again, the fact that they can get on and off in 30 days if something changes and they can talk to real support, that's your game changer. And a lot of groups that we're working with now, they're using it truly as a recruitment and retention tool. Like, how do we get our people in and how do we keep them? So being able to say that you have a virtual benefits storefront that works like Netflix, they'll get it. And we're easier to cancel than Netflix.
What about my gym membership?
There you go.
Gym membership, so the only.
No, I can't cancel it. no matter what I
Well,
try.
that is true. That is true, but in the space of health and fitness, there is a subscription-based service called Wellbeats. It's like fitness streaming. That's very reasonable that you people can purchase that as well. And again, I think that one has a 3-month minimum now because the price is pretty low, but everything else is 30 days.
Is there coverage for out-of-network providers?
Yes, there is, but on specific policies. So not all policies are going to be the same, of course. There's one policy on there that does offer out-of-network coverage.
And that would be solo,
Yes.
right? But again, I said we were gonna do deep dive, but I'll say this one. It is subject to what they call reference-based pricing. So they want to make sure these plans, that's why the price stays low. They want to make sure that the price is competitive and they're not getting overcharged, right? So the folks from multi-plan are going to be talking to the provider and saying, okay, what are you charging for this? This is what we think is fair. Your providers are not going to get involved with that. They're just good, and that's really for those folks to negotiate that behind the scenes. Yeah.
Okay.
So as far as communication, talk to Jim. We've been working with Georgette Keene. You're going to be getting a lot. So we go in email. It's going to be on socials. It's going to be over newsletters, constant contact. You guys are going to be the voice. So if you're talking to your people, you can, if you need more of these communications, you can get there's ways to get in touch with me, I can get it to you. But that, I think that, you know, the more you talk about it, the more successful it's gonna be.
Okay, thank you very much. And as we said at the meeting, we're going to email this to all the agencies, distribute to their membership. So I think this is very useful. Okay, of all, yes,
I just, I wanted to add that this is not limited to people with current EMT cards or whatever. You could have expired card, you could be affiliated with an EMS agency. You could be an MVO, you don't have to be an EMT, as long as you have an affiliation with an agency. We're trying to be as exclusive, what's the word?
Inclusive.
Inclusive, I'm losing my mind, inclusive as possible to offer this to all our EMS providers, and hopefully it will go statewide.
If someone has is an EMT, but not working as an EMT, they don't qualify, they couldn't get this, or I thought that's what we said last time, that any EMT could get this.
I mean,
Or do
technically.
they have to be affiliated? Did you say?
That's your decision, because there's no, I have some groups that have two-factor authentication because they don't want anyone else but their people getting it. We didn't set it up that way, so it's the way you decide.
They have to have a New York City
Communicate
REMSCO
that out.
card. How about that?
There you go. I found the reason to get that card.
You know what Joe did, did you notice we fixed that already from the last call? We did put, when someone goes to create an account, we asked that they put their affiliation down, is that right? Is that how we refer to it?
Yes.
Right? And then the drop-down window of 1099 or volunteer. We did that for reporting purposes, but for whatever else you want to use it or put any kind of gatekeeping on it, I mean, we didn't really do a deep dive.
okay, thank you very, you have no question?
did say it was available statewide.
Yes, yeah,
Nationwide.
nationwide. Like if you have somebody that lives in another state, but that part of your organization, Jersey, wherever, I don't know what your parameters
But-
are.
Somebody living in Erie County,
Yes,
if they're associated with an EMS agency, they can join.
yep.
And to change plans, it's that same waiting period, right? If you wanted to change from one plan to another.
Let's just say you went on solo and you didn't like it and you wanted to change to common sense or a bronze plan. You could change it within, if it's by the 20th of the following month, you could be active on the 1st of the following month. You don't have to wait a year.
Right. I'm just saying it's that same cutoff.
month.
That
Same window, yeah, just by the 20th of each month.
Okay, thank you very much. As I said, we will distribute this and hopefully it will pay off. Okay, we did leave one thing off the agenda, and of course, it's Dr. Schenker, we left you off the agenda.
I was very happy for that, and I thought that was
But,
on purpose.
Marie is not gonna let you get away.
Yeah,
Be back in the-
REMAC did not meet. We will be meeting on November 17th, I believe. I will make the announcement that on November 17th, people who have not met their regional requirements to remain on the committee as per the bylaws will be removed from the REMAC, and those positions will be made open to others who want to participate. So if you have resumes from physicians, nurses, community people who are interested, if you can reach out to Michelle, she can let you know what openings will be available, but we will be taking applications for those positions. Those people can reapply, obviously, but people who are on the REMAC need to participate. So that will be happening at the next meeting. Thank you. That ends my report.
That's a good report.
Yeah.
Before we leave, we did vote in earlier, but we'd like to welcome Mr. Pointer, who came in after the vote. Okay. To be the representative of New York State Volunteer members, and we welcome to the committee. Look forward to your participation. Any other old business, new business, any business? Yes, we do.
Just one item, on November 1st, the New York City Council is holding a hearing with regards to New York City EMS response times. They have pushed that out publicly. If there's anybody that's within the region that would like to participate in that, Obviously, that's something that is pertinent to this body and the folks sitting around this table. I think it should be made well aware to the New York City and the mayor's office and the city council that, you know, they need to be supporting the region's efforts for recruitment and retention so that the agencies within their body, within the region have the personnel to staff the units needed to keep up with response times.
Thank you. And while you're talking, whatever happened to the exemption or request for exemption for the New York City congestion plan?
The new.
Congestion pricing.
Congestion.
Pricing that is now not
Decongested.
congested, right?
I can't hear you.
Happening to.
The pricing plan was put on hold, so I think that all of the exemptions were put on hold as well, because the plan is on hold.
Yeah.
After the election, when they try to bring it back.
It's gotta be.
It's coming soon.
I
Ain't
understand.
nothing happening till after.
We have to be prepared. Very good. Okay, if there's nothing else, folks, the motion to adjourn will be in
Thank you
order.
very much.
Third.
We are adjourned. Thank you very
Thank
much for coming. See you in a month.
Thank you.